welcome in what is yet another momentous year. Last year we celebrated 45 years as a charity, and there are those amongst us that were there at the very beginning. It's a fabulous... I've come to the NKF and the KPA reasonably late in life, but what a fabulous organisation, what a tradition. And we celebrate another milestone this year. It's all on your labels. 25 years of our help desk. Stephen and Linda, fabulous achievement. And the help desk, of course, is the gateway to so many of our NKF services. We have the helpline itself, which has now moved digital in the digital age, so you can chat to them online as well as telephone them. They're the guardians of the largest, I think it's factual to say, library of informational leaflets for kidney patients in the UK. And we're very, very proud of that, constantly adding to it. And many of you KPAs help distribute those to hospitals. The help desk team also look after our peer support service, now in its third year, and we'll be hearing from Patricia, one of our peer supporters, later on today. And of course, they are a link point for you as the KPAs whenever you want to get in touch with us as well. So 2024, there's been a change of government. Regardless of your political colours, a change of government's a good thing because new governments tend to be in listening mode, and this one certainly is. And it's clear the emphasis is going to be on community care as well as hospital care. And they are in listening mode, and we at the NKF will be representing the national voice for the organisation along with other charities. And a key part of that work is the all-party parliamentary kidney group. And I'm not sure how many of you know, but when there's a change of government, all the parliamentary committees come to an end. And they all have to be re-established. And so, Jessica, are you in the room, Jessica? Oh, yeah. So Jessica, our policy and public relations manager, has got the task of re-establishing that all-parliamentary committee. Really, really important because that gives us our route to MPs. And as a KPA, you'll be asked to play your part in writing to MPs to get our case heard. We live in a world where everybody's competing for money. And in clinical areas, cancer, heart, obesity, diabetes, all big voices. And it's so, so important that we as the NKF, with other charities in the UK, work together to make sure our kidney voice is heard in amongst all that noise. More important than ever. We've also got another new addition to the team. Chris Talbot. Is Chris in the room? Go on, stand up, give them all a wave. Have you all looked to the back? So many of you might have had contact from Chris already. Chris is our NKF membership development lead. His job is all about building our membership and working with you as KPAs. If you've not met him yet, he's a pretty nice guy. You know, he's wonderful. He's really hit the ground running. So take the opportunity to search him out and talk to him. He's your primary link on how we can help and support you as KPAs, and we're very keen to do that. And as I say, Chris is here all day. A full update of the NKF and what we're doing will be given in the council meeting, so I'm not going to cover that now. I'm going to move on to what is a really great lineup of speakers that we've brought together for you today. Full of people with experience, practical advice and knowledge, which is the way we like it in the NKF. So we will thank them again later, but can you just give a round of applause for all the speakers today that have given up their time? And I'm pretty much on time, just about. A couple of things I've been asked to say. If you are asking a question from the floor, please can you wait for a microphone to reach you so we can pick up your question on the recording. And can you introduce yourself and the KPA you're from or the organisation you're from before you ask your question? Okay. So no further ado, we'll move into the first session this morning. And these two ladies who are going to do a talk on renal social workers, the role, tips and strategies, Alison and Jayne, were here last year. And very popular they were too. I think many of you were at the stand. And they were so good that we thought, right, let's get them in to come and do a talk on the main stage. So let me introduce you to Alison Richards and Jayne Davis, social workers, talking about roles, tips and strategies. Give them a round of applause.
Okay. Thank you, David. I too have washed my hair this morning. It's good morning, everyone. It's so lovely to be here today. And as David said, we were here last year, and it's a real privilege to come and present and to meet new people. So we are on a time limit, so I'm just going to go for it. So renal social workers. Yes, we are renal social workers. Yes, I've heard that we are a dying breed. But we're here today, so come and speak to us if you, because we're open to questions and we would like to meet you. So renal social workers, we have a unique role. And in that unique role, am I supposed to be doing this? Oh, sorry. We are unique role, and in that it's because we are able to build up relationships, working relationships with patients, families and carers. We see people on a daily basis, we see people regularly, and that's really unique. And also, we can continue those relationships for a long time. We do recognise that not every department has a renal social worker, and we do realise that the KPAs are really fantastic in this role in supporting patients. And there are other areas, some people have link nurses, and unfortunately some don't have anything. So we're here to try and provide some support and some advice on where to go to today. So the role of renal social worker. Let's move on. Some of us are NHS funded, some of us are LA funded, some are funded by charities, but there's usually a period of that funding, and when that funding comes to an end, it's the hope that the NHS or the local authority will take up that funding. In 2017, it was reported there were 58 renal adult social workers and 10 paediatric social workers. 2017, that's not the case now. A lot of the funding has disappeared, and we're in the process of trying to find out how many social workers we have now got supporting around the country. Also in the report, it stated that there were no units met the social work recommendations of one whole-time equivalent to 140 patients. It surpasses that. We support all the different disciplines within the renal services, so we support home hemo, hemodialysis, transplant, CKD patients, stage 4 and 5, and their families and carers. And sometimes there's not a full-time social worker in your unit. There's many social workers that work part-time. So if you go on to the role of social work, I'm not going to read them all out. I'm just going to pick out what I think is the most important, and that's advocacy. Getting support from another person to express your views. We're there to support you. We're there to work with you, work alongside you, and go to meetings with you if you feel you can't do that, if you feel you're anxious or you're not able to cope. We're part of a multidisciplinary team, so we can support in that area. We can go to tribunals with you if you need us to, and we're there to offer advice and support, as well as all the other areas there. So the other subjects that we cover are there, and you might not recognise some, but you know, it's a vast area that we support with. And we do like to do the creative activities, but unfortunately we don't always get the time to do it. And I have to say that since I've been a social worker, it's become more crisis-led, crisis intervention, and that has to take priority, of course. So I'm going to pass over to my colleague now, and she can talk more about our role before we get on to the tips and strategies.
Which one is it next? Thanks, Alison. Please don't egg me if I start stumbling. So as you heard from Alison, the renal social work role is broad and varied, and Alison did touch on some of those aspects of our work. In the next few slides, I'm going to expand a little bit further on the things that we do. But I would just like to say that these are accredited to that report that Alison mentioned just before, so that's part of, well, it's actually credited there. That's a relief. Okay, so also I'm not accustomed to public speaking, sorry. I'm better in my native environment. So as you can see, the renal patient is central to the holistic service that we provide. And here's some of the main issues and concerns patient ask for help with from us. So each of these headings bring with them many difficulties that individuals have to navigate. And if we just pick out one of those, I'll just quickly run through them. So things like housing, treatment, carer support, mental health, social life, legal issues, activities of daily living, finances. But then, the next slide, I won't go through all of these because it's really quite busy, but as you can see, if you just picked out one of those, there's a huge amount of things that escalate from that one heading. And not one of these things work in isolation as well. So someone might come to us with problems with decision making about treatment, and that might be have a knock-on effect with housing. It might also have a knock-on effect with the finances. So each one of these things are interrelated, and they all impact on the renal patient and the ability to navigate that whole process. And I've probably gone off script and waffled. So they don't work in isolation. Often each one is interlinked. A blank screen. I wasn't expecting that. I'll just go back to this slide. There is another level to it, and that's the sort of other services that we would employ. As Alison said, we will work with the MDT, we will work with communities, we will work with charities. So it's like a ripple effect, yeah, with yourselves being the central theme. So, sorry, yeah. So what I'm going to do is just highlight one of those headings that you've just seen, and that's housing. And again, you know, the knock-on effect with decline in health can precipitate quite a lot of things, resulting in potentially debts, becoming homeless, inability to pay bills, the need for, you know, treatment choices. People might decide that actually they don't want to go into a renal unit, they prefer to be at home. So again, the decision about home dialysis impacts on people's housing. The housing that they currently have may not be suitable. We get involved and help with advocating for new accommodation or adaptations, which may include grants. I did start off, I'm rambling, sorry, I did start off by saying that about debt and becoming homeless. Quite often people, as their health deteriorates, they're unable to work, or there's a reduction in finances, and that then escalates to having to prioritise what finances you use, what you use. So you know, people come to us with problems with their rent, or, you know, the fact that they're going to be made homeless due to that. We support people that make decisions about leaving their current home and moving into more supported living. There's a lot of issues that precipitate if you become more and more ill and unable to, you know, manage the home. There's a number of other things that end up happening. And we help with all of these. And as you can see, these aren't just linked to housing. Other things, you know, the inability to carry out household chores could mean that we make referrals to the community for some additional support. So, and the other thing is that we do help a lot with trying to help patients reduce the social isolation that they feel. I've just kind of rambled quickly through that, but we've got information, so come and have a talk to us about it. I'll pass you back to Alison.
Thank you. Next slide shows the case study, and I'm eager to get back to the tips and the strategies, so I'm not going to go through the case study, unfortunately, because it's going to be too long. But you can read it afterwards, and it's a case study that offers information afterwards. So what we get is a referral. This will be the result of having a telephone call or a face-to-face and getting the information and getting the nitty-gritty and finding out what's actually going on with a crisis situation. And this is the areas that we'll look at. So we'll take priority first. And the gentleman, you'll find out, is going to be made homeless. He's got no money. He's finished with employment. So we're looking at benefits to see what we can support with. There's areas, I want to point out particularly referral to OT. Now the gentleman might be made homeless, and you think, why are you referring to OT, occupational therapist, for support for aids and adaptations when he's going to probably be made homeless and he's in private rental? Well, I'm referring to OT because they might be able to put in a... Oh, sorry. Sorry. They might be refer to OT because they might be able to put in adaptations that we can put in quite easily and take out easily. But they can also provide supporting letters. They can provide supporting letters for housing applications and for benefits. So I'm just going to quickly move on to that so we can carry on with our tips and strategies, because I think that's really what you'd like to hear. I think you're next, Jane. After the debate. Yeah. We've only got 3 minutes.
I'm going to just whiz through some of these. So, as you can see, our role is we can, you know, navigate a huge amount of things for people. So first of all, seek support, you know, come and talk to us or talk to somebody about it when things start happening, rather than let it build up. In terms of when things start happening, try and identify a start date. I guess, you know, for particular benefits, people want to know when that started. Again, what we've done, we're running out of time. We're not used to this, so we are. But we've done some handouts, and they will be on the store for people to come and have a look at. But the biggest thing for us is make sure that you start doing what we call a little diary. If you can manage to do things like that, when it starts, even just for one day, you know how long it takes you to get up, how long it takes you to take your medication. If you can't do that, ask someone to help you. You know, or write it down, talk into your phone, but try and build up a picture for professionals to get an idea of how difficult things are. Good days, bad days, any day. Be honest about what you say. You know, quite often people don't give us, they don't want to tell us how bad it is, because it's quite painful to keep reliving that. Be as honest as you can with us. The biggest thing for us is, whenever you're applying for anything, is try, if you can, make copies of things. Tribunals, again, no question to us now, or even when we're working, is too daft. We will always either try and answer it or go back and find some information. And next.
So I'll take on from that what Jane's saying. Some of the areas like CAB, they do have diaries, but I would ask people to do a notebook. And I know it's long and I know it's laborious, but it's a godsend because that gives us information to help you fill a form in. But also it supplies evidence, so you can present that. We can present it to PIP. You can take it to clinics. You can present it at tribunals. And it will provide evidence. Also, if you've got somebody that comes in and does check calls, or a neighbour or a relative that helps you, you can ask them for a supporting letter. They can say, I do check calls to make sure this person's all right. It doesn't always have to be from a professional. If you haven't got a professional or a professional support, or some nurses don't give letters, then you can go to the GP and ask for a list of your health conditions. And they will, hopefully they will provide. There might be a cost to that. When you do the assessment, you can ask for adjustments. Don't be afraid to ask for adjustments. If you feel that you're in confined space and you want a bigger space, you want an interpreter, you want somebody with you, you want a male person or a female person, then you can always ask for that. So there are different areas, and you'll see from here there's different areas. What I wanted to point out quite quickly is the Turn to Us website, because they can offer grants that are linked to your profession. So if you are in retail, or if you're in farming, you can go onto their website. You can put in your profession, and you might be able to find organisations that can link to that and offer you grants. Also, make use of the charities, the NKF, the Kidney Care UK. The booklets, they are fantastic. Also, your KPAs will give you some information. But what I will say is, please, I'm going to finish it off now, but please do try and contact people early. I know it can be daunting, and I know sometimes it can be anxious, but if you contact people early and don't leave it to the last minute, then we're dealing with hopefully preventative rather than crisis intervention. And Jane and I'm sorry we've had to rush through it. Jane and I will be outside today, and we're manning the stand. Please come and ask us, or come and speak to us, and then we'll try and answer any questions that we can. So thank you for listening.
Any questions for Alison and Jane? I have one very quick question.
Okay.
It's quite a big question, but how can we as KPAs, what's the thing that you'd most like from us to help you in your role? How can we help you best?
We never get lobbied when social work roles end, and there are vital roles, because anything social can affect a person's physical and mental well-being. Yeah. And it just seems to be the first thing that's cut. And we just like support to get out there and to hear our voice, and to see how important our service is. Yeah. You know, it's vast. And it's just those areas, rather than, we just seem to be losing social workers and social work support left, right and centre, and it doesn't come back.
Thank you. That is a really great point, and money is tight. It's so important that we fight for our fellow patients, and social workers. Fighting the case for them is such a worthwhile thing to do. Thank you very much.
Thank you. Thank you, everybody.